today we are doing ethical dilemmas in healthcare. It's the May in-service. We're going to start on the first page, knowing better, doing better. You see where that is with the green sticky note at the bottom? Okay. Each year, the public rates nurses, nursing assistants, doctors, and other medical professionals very highly when it comes to honesty and ethics. Does this mean all medical professionals are always do the right thing in every situation? Of course not. Not one is perfect, but an understanding of ethics is important for anyone who works in healthcare. What exactly is ethics? Take a moment right now before reading any further and write on a separate sheet of paper your definition of ethics. We're going to keep reading. Now consider this. Can ethics be taught? You may argue that if it can be taught, there is no need to read this lesson. Or may think of all the crime and injustice in the world and wonder why the individuals who commit such acts never learned ethics. The reality is that ethics can be taught and learned by most individuals. However, it remains a personal choice. Each day you must make personal choices about things that affect you. Your family, your clients, your friends, your coworkers, your neighbors, people driving down the street, a man out walking his dog. Wait, stop. Are you wondering how your personal choices affect some stranger's walking his dog? Well, what if you make a personal choice to take your eyes off the road as you dig in your purse for your ringing cell phone? Suddenly you swerve, hit a man who is out walking his dog, and change all of their lives completely. Many small details of life can, even deciding to answer a cell phone call, can involve making an ethical decision. Ethics become even more important in healthcare because human lives are at stake. Maya Angelou wrote, "I did then what I knew how to do. Now that I know better, I do better." The purpose of this in-service is to bring attention to the ethical issues you may face in your daily work. By helping you know a little more about certain issues, you may find it easier to know better and do better. Okay, on page 2, I'm going to read on the right-hand side a few terms to know. Values. Values are what we believe to be worth and importance in life. We generally learn values at home from our family, but we can also be influenced by friends, school, church, and overall society. For example, some families place a high value on accumulating wealth. Other families place high value on charity and building a better community. Our values often determine what decisions we make in the world. Morals influence the way we decide what is right or what is good or bad. Morals are shaped by our values. For example, someone who places high value on accumulating wealth may decide to build a shopping mall, which makes money, instead of a playground, while the person who values the community may decide a playground is the right thing to build. Ethics are several definitions for ethics, and here are a few. The decisions or choices and actions we make that reflect and enact our values and morals. B, the study of good and right behavior and how people make those judgments. C, the core values that guide our decisions and actions. Ethical dilemmas are situations that require ethical judgment calls. Often there is more than one right answer and no win-win solution in which we get everything we want. Summary is our values, which are generally taught at home and influenced by society, shape our morals. Our morals influence the decisions we make during ethical dilemmas. Food for thought, right? We're going to skip around to page 4. I'm going to read the bottom, autonomy. Autonomy means that each individual has the right to make decisions without being pressured by other people. People demonstrate their autonomy when they make healthcare decisions based on their own values and beliefs, even if other people disagree with them. For example, refusing blood transfusions because of religious beliefs, having an abortion, leaving the hospital early against medical advice. Please note that both informed consent and autonomy are overlooked during medical emergencies. For example, a man is brought to the emergency room after a serious car accident. He is unconscious, bleeding, and in need of surgery. Doctors won't wait until he wakes to explain why he needs the surgery and to ask for his permission. They assume that the man wants to live, so they do everything they can to save him. All right, the next page, confidentiality and privacy. Confidentiality is one of the basic rights of every client. However, the issue of confidentiality has become more difficult in modern times. Many medical records are now stored on computers, which may make them open to theft by computer hackers. There are times when it's legal to share your client's medical information with others. These include for testimony during a court case, to report client abuse, to report a client's infectious disease such as tuberculosis. Generally, no one outside your workplace has the right to know anything about the client, even the fact that they are your client. What do you think? You care for Mrs. Daly at her home. Recently, Mrs. Daly's adult son has moved in with her. Since he arrived, you've noticed that Mrs. Daly has bruises on her arms and back. She seemed frightened of her son. Although she tells you that she loves having him live with her, do you have the right to discuss Mrs. Daly's case with social services without her permission? Or does Mrs. Daly have the right to total confidentiality? I think we have the right to speak with somebody about her safety because you are a mandated reporter. All right, we're going to go to, I'm kind of skipping around because I went through all of the questions and I'm finding the highlighted areas, and that's kind of what we're doing here. So we're going to go back to page 3 under making ethical decision. It would be easy to make an ethical decision if there was only one right answer, wouldn't it? Unfortunately, the reason a situation becomes an ethical dilemma is because there is more than one acceptable course of action. Making ethical decisions requires some common sense, patience, compassion, and communication with others. While there are no set rules for how to make an ethical decision, there are some useful guidelines. Number 1, define the problem. Be sure you have the facts. Ask yourself, what is the ethical dilemma that makes me uncomfortable? Number 2, list your choices. Think of as many alternatives as you can for how you might solve the problem. Ask yourself, what choices do I have? Number 3, narrow it down. Decide which choices are acceptable. Ask yourself, will I be able to sleep at night if I decide an alternative number 1? Will anyone be hurt if I decide on alternative number 2? Seek guidance. Ask for help if needed from coworkers, supervisors, or an ethics committee at your workplace. Ask yourself, is this my decision to make, or should someone else decide? Consider the consequences. Make your ethical decision by picking the best course of action. Ask yourself, if my decision was published in the local newspaper, what would people in the community think of me and my workplace? Number 6, act on your decision. Tell yourself, it's not enough to think about what's right. I have to do what's right too. And number 7, reflect on your decision. Try to look back and see if your decision was really best. Ask yourself, would I do anything different if I could do it all over again? All right, let's see, number 6. All right, how about page 7? Euthanasia. Euthanasia is a Greek word that means an easy death. In healthcare, this word is used to describe the process of ending a human life on purpose. You might also hear euthanasia as the right to die or physician-assisted suicide. There are different levels of euthanasia, and including the first level is known as pulling the plug. This involves removing a comatose or brain-dead person from the machines that are keeping him alive. This type of euthanasia is considered acceptable by some people. Others feel that once a person is put on life-sustaining machine, no one has the right to stop the treatment. The second level of euthanasia involves giving high doses of morphine to patients who are in the final painful stages of a terminal illness. The morphine relieves their pain, but it also slows down the patient's breathing. If the dose is high enough, the patient stops breathing entirely. The third level is the most controversial. It involves helping people who are not near death to end their lives. These people may have an illness such as cancer or Alzheimer's disease that will become painful or debilitating in the future. They want to end their lives before this happens. Those in favor, people who favor the right to die, believe that everyone should be able to die at the time and manner of their choice, and feel that too many suffered needlessly during the dying process. Those people who are against it, the right to die, believe that euthanasia will lead us down a dangerous path. Who will decide when it's time for someone to die? Will older people be forced to agree to euthanasia to free up healthcare dollars? In addition, they don't believe that doctors should be put in the position of playing God. Some people might see a do not resuscitate order, a DNR, as a form of euthanasia. This is not true because a DNR order does not bring on death. It just means that no extraordinary measures like CPR or using a ventilator will be taken when the patient stops breathing. DNR orders are never written without the consent of the individual and or his family. Go to page 9. On page 9, under ethical traps, if something is necessary, then it must be right thing to do. Here's an example. Mrs. Chase has fallen down several times recently. She is elderly and slightly confused. The doctor is worried that she's going to break her hip if she falls again. He says it's necessary to protect her from falling. Your supervisor orders you to tie Mrs. Chase to her bedside chair with a chest restraint. Remember, just because something is necessary doesn't mean you can do anything you want to make it happen. You still have to consider Mrs. Chase's rights and look for alternative ways to solve her problem. Okay. I'll read the next one. If something is right for your client's own good, then it must be the right thing. Here's an example. Mr. Smith has lung cancer and is on oxygen at night to help him breathe. The doctor tells your supervisor that if Mr. Smith doesn't stop smoking, he'll soon have to use oxygen 24 hours a day. Your supervisor orders you to take away Mr. Smith's cigarettes and tell him that he is no longer allowed in the smoking lounge. Remember, just because it will be good for Mr. Smith to stop smoking doesn't mean that you can ignore his right to smoke. If no one gets hurt, then it must be the right thing to do. Here's an example. Mr. Dodd and Mr. Tuttle both wear adult diapers. Mr. Dodd's insurance company pays for his diapers, and he always has extra at the end of the month. Mr. Tuttle's family has to buy diapers, and he's always running out of his supply before the month is over. You decide to use Mr. Dodd's extra diapers for Mr. Tuttle, since the insurance company can afford the extra diapers and Mr. Tuttle's family can't. Remember, it might seem like no harm comes to Mr. Tuttle by sharing his diapers with Mr. Dodd. However, it is technically stealing. You use his diapers for another client. What if Mr. Tuttle's family asks what happened to the extra diapers? Be sure to consider all the consequences of your actions before you decide that no one will be hurt. Let me find where number 8 was. All right, on page 7, on the right-hand side, under the next step, apply what you've learned. Do not confuse ethics with religion. Religion provides rules that a person must follow to live a good life. For example, one of the 10 commandments is, "Thou shalt honor thy mother and father." This strict rule doesn't leave any room for discussion. If you show respect to your parents, you are a good person. If you disrespect them, you are bad. What if the parents are abusive? What if the parents abandon their child? Do the children have the right to honor them to be good people? Ethics is different from religion because it provides guidelines for looking at different acceptable alternatives for every situation. The final decision for how to live a good life is left up to individuals. How does your religious philosophy influence your ethics? What rules are required by your religion? And does your religious text state that working on Sunday is against the rules? What if you have to work on Sundays to feed your family or keep your job? And remember, no, we're almost there, girls. All right, how about go to page 10? What is a whistleblower? It's at the bottom. Page 10. Whistleblowers are not troublemakers. They are people who have the courage to speak out when they witness abuse, neglect, and other unethical behaviors in the workplace. Usually they start by telling a supervisor about the problem. Employees who observe unethical behavior face the ethical decision of their own. Do they tell the truth, even though it may mean ratting on a coworker? Or do they ignore the situation, even though other coworkers or clients may suffer? If you witness unethical behavior, you must make your own decision about whether or not to blow the whistle. Would you blow the whistle if one day you witness a coworker slapping her client? Would it make a difference if you'd seen that coworker slapping other clients before? You smell alcohol on a coworker's breath. What if you see him taking sips from a small bottle of whiskey he keeps in his pocket? You see a coworker taking syringes or needles home with her. Would it matter if you knew the syringes were for her diabetic mother? These are all good questions, huh? All right, and the last one I have marked for us will be on page 3. What excites you on the right-hand side? An apology can make all the difference. In recent years, there has been a trend toward physicians telling the truth and apologizing for any medical errors that affect patients who are under their care. This trend started out as a way to reduce the number of malpractice lawsuits brought on by disgruntled patients. But the actual act of coming clean and expressing sincere regret can be a profound effect on everyone involved. For the physician, an apology can help diminish feelings of guilt and shame. For the patient, it can pave the road toward forgiveness and emotional healing. An apology includes being honest about the event and your role in it, and a genuine expression of regret for the outcome. Some people argue that admitting that you are wrong is a sign of weakness. Others argue that it's a sign of strength. All right. That is it. We're going to go through the questions. All right. Number 1, true or false? Medical professionals are always ethical and always do the right thing in every situation. False. Although the public perceives medical professionals as the most ethical people, medical professionals are human, and ethical decisions making remains a personal decision and involves personal values, morals, history, and motivation. So again, number 1 was false. Number 2, true or false? Our values shape our morals, and our morals influence the decisions we make during ethical dilemmas. True, right. Our values do shape our morals, and our morals influence the decisions we make during ethical dilemmas. Number 3, true or false? Autonomy means that our client can earn the right to make their own decisions if they prove they can make good choices. False. Autonomy means that each individual has the legal right to make decisions without being pressured. Number 3 was false. Number 4, true or false? Let me try that again. It is legal to share your client's medical information with others if you suspect your client is being abused. True. There are several unique instances when it is legal to share your client's medical information with others. For example, if you suspect your client is being abused, it is appropriate to share the information with a social worker so that intervention can be initiated. So number 4 was true. Number 5, the first thing you should do when faced with an ethical dilemma is B, you're right. Define the problem, list your choices, and consider the consequences. Number 6, true or false? A do not resuscitate order, DNR, is a form of euthanasia. False. False. A DNR is not a form of euthanasia. A DNR order does not bring on death. It just means that no extraordinary measures like CPR or using a ventilator will be taken when the patient stops breathing. Number 7, true or false? If something is for your client's own good, then it is the right thing to do. If something is for your client's own good, then it's the right thing to do. False. False. Just because something is for your client's own good does not mean it's the right thing to do. This is a common ethical trap, like tying that lady up because she may fall. It's not the right thing to do, to tie her up so she doesn't fall, even though she needs to not fall. So 7 was false. 8, true or false? B. Well, let me read it. Grace is an overachiever. Being religious and being ethical are the same thing. Close. That's right. Religion provides rules that a person must follow to live a good life. Ethics are different from religion because it provides guidelines for looking at different acceptable alternatives for every situation. The final decision for how to live a good life is a choice left to each person. So 8 was false. 9, true or false? Whistleblowers are tattletales and troublemakers. False. Well then, false. Whistleblowers are people who speak out when they witness abuse, neglect, and other unethical behaviors in the workplace. So 9 was false. And 10 is a fill in the blank. So an apology includes being honest about an event and expressing genuine regret for the outcome. So the fill in the blanks are honest and regret. You're welcome. So make sure you fill out your name, date, sign it, and fill out the back.